This is an anatomical model of your shoulder girdle. This bone here is the upper part of your arm, or your humerus. This is your shoulder blade, or your scapula. It is connected to your clavicle, or your collarbone, which extends through and attaches to the sternum in the front of your chest. The area in between where my finger is the upper part of your rib cage. And then your neck goes up into your head right here, and your spine runs down the center of your back right there. The upper part of your humerus is quite rounded because it's a ball and socket joint, and this is the ball. The tendons of all your rotator cuff muscles attach onto this ball, as do the long head of your bicep, which is this tendon right here. It is deemed a ball and socket joint, but as you can see here, the socket is really quite shallow. It's much more like a golf ball on a golf tee. So we do have what's called our rotator cuff, which is a group of 4 muscles that works to dynamically stabilize and hold the ball in the socket. You'll see here the rotator cuff is not one structure, but 4 muscles. This muscle here is called your supraspinatus. It attaches from the shoulder blade and goes down to the top part of the humerus and turns into tendon and attaches onto the bone right there. This is called your infraspinatus. It also turns into the ball of tendon and attaches onto the top part of your humerus right there. This is called your teres minor. And underneath you will find what's called your subscapularis, the 4th one of your rotator cuff muscles. As I said, they all work together to help hold the ball in the socket. So your rotator cuff were deep stabilizing muscles. Here we'll look at the more superficial moving muscles. This is the ridge of bone you'll feel on the back of your shoulder blade, and attached to it you'll see the upper fibers of your trapezius that connect your shoulder to your neck. Major shoulder stabilizer and mover. This is the back part of your deltoid, the middle section, and a front section that helps elevate your arm. Now your trapezius continues from your shoulder right down into your mid-back. If we take that off and look underneath, you'll see your rhomboids. They connect your shoulder blade to the center part of your spine and help retract or pinch your shoulders back. Above there you'll see your levator scap. It attaches from the top part of your shoulder blade right up into your neck. It's a major stress and tension point for people. If we look at you from the front, here first you'll see your pec major, which attaches from your ribs, sternum, and collarbone and goes right into the front of your shoulder, and then also the front part of your deltoid that acts to help lift your arm up. If you take that off and look underneath, you have what's called your pec minor, which attaches the front part of your shoulder girdle to your ribs, and the long head of your bicep that attaches your arm to the front part of your shoulder girdle as well. Right here is your collarbone and where it meets your sternum, right in the center of your chest. Here again you have your shoulder girdle. You have your collarbone in the front, the upper part of your arm on the side, and your shoulder blade in the back. This whole complex sits on the upper quadrant of your rib cage and is only attached by a bony joint where your collarbone meets your sternum in the center of your chest. The rest of it's all muscles. There's muscles that pull it up, muscles that pull it down, muscles that pull it back, and muscles that pull it forward. The health and mobility of your shoulder is very related to the overall muscle balance and posture of your body. Lifting your arm above your head requires movement in both your ball and socket joint and your shoulder blade. If you can lift your arm to 180 degrees above your head, about 120 degrees of that should happen through the ball and socket joint. and about 60 of it should happen as an upward rotation of your shoulder blade on your body. Ideally, these motions happen in a coordinated manner together, as opposed to all one and then the other. Unfortunately, some people develop muscle imbalances that really restrict the mobility of their shoulder blade and forces far too much movement in the ball and socket joint. This is a great way to pinch tendons of your rotator cuff and leads to a lot of injuries and shoulder pain. With good posture and shoulder mechanics, you will notice that the shoulder blade upwardly rotates and elevates with the arm as it lifts above the head. With bad posture and shoulder mechanics, you will notice a lot of times the shoulder will actually depress as the arm goes up and tends to move more outward than upward and in front. This can lead to a lot of stress and strain on the rotator cuff and the nerves that extend between the neck and the shoulder. This muscle is called your lat. It plays an important role in the strength and stability of your shoulder, as well as the posture and mobility of your torso. It connects from the fascia of your low back up into your armpit and over into the mid part of your spine. It acts primarily as a shoulder and arm depressor, which puts it in a tug-of-war with the upper fibers of your trapezius. Your lat is a very important muscle, but it tends to be well overused when it comes to people's standing posture. In order for you to lift your arm above your head properly, you need your lat to be able to lengthen, so your shoulder can upwardly rotate as you lift it up. Overuse of the lat can end up depressing the shoulder as the arm's supposed to go up, which can compress your upper ribs, can lead to pinching of your rotator cuff, and a traction injury of the nerves that come between your neck and your shoulder. The essence of core stability is your ability to stabilize your torso and pelvis while moving your arms and legs. The strength and mobility of your shoulder depends strongly on your ability to use your abdominals, diaphragm, and glutes to stabilize your torso. It's very easy to develop what I call the tail that wags the dog syndrome, where you use all your shoulder retractors, depressors, and spine extensors to lift your arms up. This is a common practice that can lead to all sorts of back, neck, and shoulder dysfunction. Overuse of your shoulder retractors and depressors can create a deceiving amount of shoulder inflexibility. It is responsible for a lot of mid-back pain and chronic tension points in the upper fibers of your trap. It can be responsible for chronic tension headaches, nerve-related arm pain, and chronic impingements of your rotator cuff. It is important to remember that good posture involves your arms hanging passively down the midline of your body. You do not want to be walking around with your shoulder blades clenched and pinned behind you. This will result in a lot of shoulder inflexibility and likely lead to pain in the long run. As I mentioned earlier, your shoulder girdle is only attached by a bony joint where your collarbone meets your sternum in the center of your chest. The rest of it's all muscles. There's muscles that pull it up, down, back, and forward. With an ideal posture and muscle balance, your collarbone should sit on a slight upward angle of about 20 degrees. If you tend to overextend your back and over-retract your shoulders, you can lead to a depressing of your shoulder girdle, which can lead to an undue amount of stress on your neck and chronically lead to shoulder impingements. This ideal upward rotation position allows freer neck movement and more shoulder flexibility. If you look at the position of your shoulder blades from the back, they should sit on a slight upward angle. Over-retraction with your rhomboids and your lats can lead to a downward rotated position. Your trapezius attaches majorly onto this ridge of bone on the back of your shoulder blade. Overuse of your rhomboids and your lats can lead to a downward rotated position. This will put a lot of undue stress on your upper trap and can lead to painful trigger points. It will also not allow a proper upward rotation movement of your shoulder as you lift your arm, which can lead to chronic shoulder impingements and issues with your rotator cuff. Shoulder impingement is the most common cause of shoulder pain I see as a physiotherapist, and is primarily related to posture and muscle balancing. The tendons of your rotator cuff attach onto the head of your humerus here, and it is really common to pinch those tendons between the head of your humerus and this bone right there called your acromion. This can be acutely painful and create a lot of local inflammation and swelling. The root cause of this issue is primarily related to the postural muscles that are affecting the position and mobility of your shoulder blade. If the muscles will not allow a natural upward rotation of the shoulder blade, the clearance between the head of your humerus and that acromion becomes very small. It becomes very easy to pinch the tendons of your rotator cuff when the shoulder blade doesn't move properly.